Hello, and welcome to another Psyche Innovations webinar. Thank you for joining us. I hope that this evening will be an interesting topic for all of you. And as always, please shoot through your questions as we go in the chat. We'd love to engage with them as much as possible. So without further ado, let's jump right in. So today's topic is Beyond the Hour, Extending Care Between Sessions. We are joined by Claire. So Claire is an HPCSA Registered Counsellor working in public health, providing services in clinics and day hospitals in Tygerberg area. She's passionate about mental health as an advocate and is committed to accessible and equitable care. Her research interests lie in community psychology, intersectional theory, and improving access to mental health services for vulnerable populations. If you're a registered counsellor, please go check her out on social media and join her community, the Cape Town Counsellor. She's doing a lot of really cool work in that space. And then outside of work, Claire enjoys cooking, spending time with family, and finds her deepest rest on her in-laws farm in the Northern Cape. Please join me in welcoming Claire. Thank you for being here, Claire.
Oh my goodness, thank you for having me. I'm really excited. I actually forgot that I wrote that bit in the bio about my in-laws farm, and it's really taken me back there after a busy Thursday.
Good, I'm glad. We all need that sort of space where we feel we can rest and relax and disengage for a bit. Right, for those of you who don't know who I am, I'm Dr. Daniel Page. I am the CEO of Psyche Innovations, who's hosting this event. My background is in psychology and molecular biology. I studied in Stellies and also through the University of Queensland. And now I run Psyche Innovations, which we'll tell you more about. And then we'll jump into the topic. Claire and I will be asking each other some cool questions that hopefully dig into some very interesting insights. And as always, please shoot through lots of questions. But before we do that, I'm just going to explain a little bit about what we do at Psyche Innovations. So we design and build the Psyche Mental Health app, which is all about helping people measure their mental health and well-being using a holistic assessment. We then help users learn psychological skills that people can use in their everyday life. These are things like imagery and self-talk. Then we also do goal setting and help people set structured goals using the SMART goal framework. And then we've also recently released an AI companion that people can use to journal and learn more about mental health and explore their wellness. So we also have a special sort of collaboration going on with Claire and the Cape Town Counsellor. We have a whole host of services for mental health practitioners, chiefly being the ability to use our Psyche Mental Health app, which does a lot. I'm not going to go into too much detail because obviously we're here to talk with Claire. So I really encourage you to go check it out on our website and download the app. And because of the collaboration with Claire, you can use her Cape Town Counsellor code and get a discount every month on using the service as part of your practice, no matter what kind of mental health and wellness practitioner you are. So yes, let's have a chat, Claire.
Let's have a chat.
Right.
Okay.
Kick us off. What's on your mind?
So, I mean, when I first looked at the app, so the first thing that drew me to it was the little logo. I love the lion. It's so fierce. It's all the rainbow colors. And I don't think it was quite what I expected when I went into the app. Like, I know we'd had an online meet and you kind of told me a bit about it. But still, when I opened the app, it was just, I don't know. I still sent you an email afterwards. I was like, this app is so cool. And I genuinely feel that way because the number of times I've sat for hours on end trying to find a suitable resource that's evidence-based to give to a client to do between sessions that is also going to be engaging, because I don't want to just give them crap, and they sit there, what is this? And I almost can't believe that something like this didn't come along sooner, if that makes sense. So I'm excited, really excited.
Thanks, Claire. Yeah, it has been a big labor of love, and for exactly those reasons you pointed out is why we wanted to work on it and build it, is that it is really hard. If it's hard for practitioners to find evidence-based and useful resources, it's particularly hard for people who are looking to improve their mental health. Because everyone says, the internet's there, you can go find something. But it's particularly difficult for people who don't know a lot about mental health. They don't know what they can use, what's trustworthy, what'll work, what they can integrate into their life. And that was a large part of the mission behind this, was to take what we knew worked in academia and in practice and distill it into something useful that people could sit with and learn very quickly without making it too flashy or too complicated. Because I think a lot of the important skills and habits that we build are at their core quite simple, but it's building that key knowledge that we need and challenging old attitudes and beliefs that hold us back, and then that behavior change, right? I kind of talk about this a lot and say, like if you look at the example, and it's not a particularly, sexy example sometimes, but if you learn goal setting but you never use it, it's kind of a useless tool. So that was also a part of the big challenge, is creating resources that people could use by themselves as individuals, as well as practitioners with their clients, or even for themselves. Everyone's struggling with burnout and work pressures, and so yeah, that was the part of the thing.
I had a good laugh. As you said, goal setting is not particularly the most glamorous one. And that's the one that I did today. I think I did one of the goal setting ones, and time management. Sorry, there is a tarantol going on in the background making a noise. So if anyone can hear that, I apologize, but it's on the neighbor's roof. So I don't entirely know what to do about it. Hopefully my voice is louder. But I did the goal setting, one from goal setting and one from time management today. And it got me thinking. The time management one, I'm quite an efficient time management person. So I did it and I was like, okay, cool, that was nice. I kind of knew that. And then I did one from goal setting, and then I learned something there. And I think what stood out for me was that I'm coming from a place where I do this as a job. So time management skills, goal setting skills, yeah, okay, that is maybe stuff that I know, but trying to think about my life, if I didn't know those simple things, it would make my life very difficult. So this is a fantastic app I'm thinking in terms of using it with clients. If you have a client who perhaps has very poorly managed ADHD or has difficulty with executive functioning skills, even an occupational therapist, could definitely make use of a tool like this to gradually introduce simple skills, but that hold a lot of value. And like you say, they're applicable. They're not these abstract concepts that people who are not mental health professionals or psychology professionals, they can use. So I thought that was pretty cool. Sorry to have broken your word.
No, thanks. I appreciate that. And that sentiment is something that we've heard before. Before I started building the company and I ran interventions, I remember one of the students, she came from Kaimundi, which is a community just outside Stellenbosch, and was a first-generation student. And I remember her coming up to me afterwards and saying, like, how angry she was, or angry is maybe not, upset she was, that she hadn't learned a lot of these skills in school and at university. And it was the first time learning how to do like structured goal setting and self-reflection activities. And the penny really sort of dropped for me, and I realized, we assume that a lot of people know how to do these things, but they don't, and they're not taught in a structured way, especially how to integrate it into their life. And that was a big driving force behind it, is making things accessible and usable and fun. And obviously there's limitations on like how fun something is, but that's kind of the big challenge. And one of my good friends, he recently took a day off from work to just journal, because he realized that he started going to therapy and he wanted help, but he was struggling to find the time to actually do a lot of these core activities and self-reflection. It's like, okay, the only way is like if I do this hard,
It'll take a whole day.
Yeah, well, he's luckily in the position that he's able to do that, and most people aren't. And that's also something we try to keep in mind is, you're awake for 110 hours in a week, and that's a lot of time to fall into bad habits or to engage with the wrong things. And because if you're lucky enough to see a practitioner that's helping you and teaching you things, there's all this space in between where you're forgetting and you're disengaging and you're not remembering what worked and what didn't work. So we also wanted to create something where people could take notes. They could journal sitting on the taxi or after class, if you're a student, or that kind of thing. So it made it easier to stay focused and keep the mental health process top of mind.
Well, I suppose, just as you're speaking about this person, who's started therapy, started a therapeutic process, and is now wanting to do these activities outside of sessions. That is often something that I speak to clients about. And, they'll come in and they'll say, well, I've been coming to counseling and I'm not seeing change. And, I come here and why is it not happening here? And it's about me reminding them that like 80% of the work happens outside of the session. It doesn't, it's what you take from the session, yes. And don't get me wrong, a lot of healing happens when a person is just present with you in the mess, in the stress, in the hardship. A lot of healing happens there. And there is also a lot of value, especially, look, obviously this would be more in the scope of, a psychologist. Counseling is a lot more practical in South Africa. However, there's a lot of value that a psychologist can bring in the session. But it really doesn't take away from the fact that if once the client steps out of the session, they don't follow through. And, even just thinking of, when I was in private practice or now working in state, the number of clients that, I'll give them an activity and then they come the next time and they either lie about it, they say they did it, and I'm like, I know you didn't do it, or they just outright forget. I can see kind of how this app could really fill a gap there.
Yeah, I agree. And that's, I guess, leading to sort of one of my questions is, from your experience, what tends to happen between sessions for most clients, especially when they're struggling with motivation?
Well, it's a difficult one, because if you're struggling to find motivation, it doesn't matter what your presenting problem is, what your issue is, you're not going to be inclined to do the work between sessions to address it. Whether that is your psychologist taking a CBT approach and, getting you to go and try certain activities, whether it is, more psychodynamic maybe, and they give you an insight and then they say, all right, go and reflect on this or journal about this, and they don't do it, it affects the process, because we're not giving you that work just for fun, just to be mean and say, here's some homework, we're in a position of power, we can give you homework. There's meaning behind it. It's where more learning and insight comes. So if it's not being done and it's not, clients aren't following through and doing those activities for whatever reason, right? Whether it is they forget, or they don't feel they don't have time, or maybe it is boring, maybe a generic printout from therapist aid, or not to bash them obviously, but we've all used therapist aid, and maybe the client's just not interested. Whatever the reason, them not doing that work in between sessions affects the process.
Yeah, and as you were saying, there's so many barriers as to what could, like, there could be personal, there could be socioeconomic, there could be, and not the right resource at the right time. It's not personalized enough, and so the way I like to think about it is removing as many barriers as possible to make that little bit of motivation lead to sort of an action. Kind of like the app functions essentially as like putting your gym shoes in front of your bed, so that when you wake up, it's just a little bit easier to put them on and go for that run or go to gym or whatever your habit is. And that's how we like to think about it, because we know, especially when you're struggling, it's hard to do the things that you need to do and the things that benefit you, whether that's eating your vegetables, learning and applying a skill. So we try to keep that in mind.
I think
this sort of
sorry, no, I was just as you were saying, the things that we've got to do to benefit ourselves. And I think that's also important to, that balance you said you were trying to find in terms of fun. These are activities that the ones that I've done, the intention is, they're user friendly, they're enjoyable, but I don't actually feel it's required for them to be fun. It's not a game. It's not Candy Crush. It's not your favorite TV series. You're doing work. You're busy learning something to better yourself. And look, I mean, I love vegetables, so that's not a very good example for me. But I mean, if I think of my husband, he's not a big fan of vegetables. He's an Afrikaans man who thinks chicken is a vegetable. And when it comes to eating,
isn't it?
I mean, I don't think so. You may have a different opinion on the matter. But when it comes to eating vegetables, for someone, perhaps that's not always the most enjoyable thing. Not everyone likes vegetables, but they're healthy, objectively, science tells us, and you need to do it. And it's the same with the work between therapy or between counseling. It's not always super fun and like rad cool, but it's something you need to do. And this makes it enjoyable, so that they can take that little bit of motivation that I'm thinking, client with severe depression maybe doesn't have lots of motivation. They can't upward motivate themselves to do stuff. Someone with ADHD, perhaps, getting themselves to do tasks and holding themselves accountable for longer term processes is hard. It's not a skill that, is effortless. I mean, even those ordinary people, accessibility, it's going to help someone to develop better habits, because if it's easier to do, you're going to do it more, and then you're going to learn or to get the opportunity to see the benefit.
100%, and they stack and build on one another. So one of the things that we're trying to do with our approach is keep mental health top of mind, keep people engaged in the therapeutic process so that they see the journey through. And that kind of leads me to one of my questions is, how do missed appointments or late cancellations impact the therapeutic process or even your practice? Claire, we can't hear you.
You see, this is why I see clients in person, because the amount of time I would spend on mute otherwise is unacceptable. So my answer would probably be quite similar to my answer from earlier around what happens if a client doesn't do the work in between sessions or doesn't maintain accountability between sessions. And it interferes with the process, because what a lot of people don't know, unless you've maybe been to therapy or counseling before, is that it's a process. It's not a once-off session that's going to be a remedy or an opportunity to heal. It's a process. And if you are not doing the whole process, I mean, we'll extend on that gym metaphor you made with the gym shoes. If you're putting on your gym shoes and going to gym, but then eating in excess of what calories you're burning at gym, you're not going to see results. So you're doing half of the process. And it's the same if a client doesn't come for sessions, if they don't do the work in between, if they aren't honest in the session, if they, there's lots of barriers to having a successful process, and one of them is if they're not attending their sessions. And then I reflect to the idea of, okay, well, practice, if you're running a private practice like many health professionals are, and clients just don't come, I mean, that's going to impact your revenue. Not only thinking of the client themselves, but it impacts, like, at the end of the day, whether you get to have, you pay for your own therapy session. So all of these things, they impact the process, but they also impact the clinician, and the clinician may become resentful towards that client. While we don't ever show it, it sits there. It's something we've got to sit with, and you don't ever want to be resentful towards a client just because they're being thoughtless rather with your time. So I don't know if that answers the question.
No, 100%. It definitely does. It interferes with the process. It affects the client and the practitioner in multiple ways.
For sure. I mean, I think now the number of no-shows that I get in state is much higher than when I was in private practice. It's an entirely different dynamic. But regardless, it affects the process in the same way. Yes, I get paid by government, so it's a slightly different setup. It doesn't affect my my practice, but resentment can build. If I'm sitting there and I'm expecting and I've prepared for a session, and then my client's just like, well, nah, thanks, not today. It sits with the person. I mean, we're also only human.
Of course. So, Claire, how much of a practitioner's time is spent repeating psychoeducation or hunting for the right resources to send a client?
I don't know if I want to disclose that. Too much time. Look, I do think as you go along in your career, it requires less time because you find a couple of really good resources, and there's some that are quite generalizable. Is that a word? To lots of different clients, and then that's a different story. But to be honest, I mean, I've been practicing for where are we now? 5 years, 6 years, something like that. And I'm still having to go on Therapist Aid or Canva, which is never a good idea. I shouldn't be allowed around technology, but I'm having to spend time finding resources that are suitable for a specific client, because perhaps one resource is almost suitable, but then it's not in the right language, or it's not at the right sort of developmental level, and then I've got to find a whole different resource. In my case, and this may be unique to people who are working in state, but we don't always have internet or a computer or a printer or paper. We've actually got lots of printers, but not always paper. So then it's difficult to gain. Whereas I think most of my clients at this point, even in lower income areas, have either a cell phone themselves or have one within the household. So, I'm thinking, like, maybe you can tell us a bit about how the app could be used in these sorts of circumstances, where there is a phone, there's Wi-Fi, or there's enough data. I'm just would love to hear more about that.
Yeah, 100%. That's definitely something we've taken into consideration a lot. So people, like all the resource constraints you mentioned, there's even more. A lot of people live in very, out of the reach areas, can't access clinics or governmental services or private services. But most people can access a phone. So smartphones are, more people have access to smartphones than flushing toilets in South Africa. So we kind of, yeah, I know, it's weird, weirdly surprising. And that access is just expanding and expanding. So what we kind of realized is that technology was a way that we could increase accessibility, because I came from a humanitarian perspective, I guess. It's like how many people can we help? So tech can overcome a lot of barriers. Obviously it's like not a silver bullet. It doesn't solve all problems, right? I'm not going to sit here and pretend that it does. Then we took into other considerations. We tried to make the download as small as possible, and you only download as much of the platform as you actually use. So rather than having a big initial download, you just kind of download as you go. We try to keep literacy levels very simple, so that teenagers and adults can use the platform. So that's another consideration we had. So literacy level, simple language, the activities are pitched at a sort of cognitive level of a teenager, which means that an adult can benefit from it just as much as a teen. The activities are short and quick, keeping in consideration that most people don't have a lot of time, and we're trying to squeeze in value as quickly as possible. But of course, you could sit on the platform for hours on end, completing everything, because people are different, right? Some people, they use a resource once or twice and they get a lot out of it, and other people will use every little bit. And then something else we kind of considered is that not every skill or approach is right for every person, and people are looking for different things. I kind of often make this joke that I know yoga is really good for you, but like I'm so inflexible that I don't know if I'll ever give yoga a try. And that's kind of our approach, right? It's like we give people a range of different skills and offerings that suit them. And everyone, as true as it is that goal setting can help everyone. I remember having a conversation with my friend's mom. She's like, I don't believe in goals and whatever. And that was just her whole framework for life. And she's a very successful OT, or occupational therapist. So I was like, well, maybe you don't call them goals. You call them life missions or things that you're focusing on. And everyone has their own different language and way of thinking about things. And that's what we try to do, is pack in as many different approaches as possible. And also something we wanted to be stay very far away from was using pathologizing language. We're not labeling people as unwell. Our mental health assessment is all about looking at the domains of wellness or well-being, if you want to use that word, which all of us have, that all of us can work on improving. And this is true whether you're doing really well and everything's going right for you, or somebody who's really struggling and feels that they're rock bottom and is trying their best to go to therapy and get help. So these domains, everyone can work on and learn skills on, and practitioners, they'll all have their own modalities and approaches, and they're the experts at doing diagnosis and treatment. We're not trying to interfere with that in any way. So the tool takes into consideration some people will use it completely by themselves, will never access mental health care because they might not need it, or they might not be able to access it. And other people will be using it as part of the therapeutic process with their practitioner between sessions, or maybe even afterwards. They might complete the process and still use it long term. So we appreciate that lots of people will hopefully get value from it in different ways at different times.
Daniel, can I break your word for a second? I'm noticing I'm getting quite dark here. In that the sun is going down and the lights are not on. Can I quickly switch on a light before it gets too dark, and then I just disappear the background?
That's all right. So yeah, we took a lot of these considerations into mind when we were building the app, and our approach is to keep in consideration the sort of different lived experiences of people around the world. And the starting point was building something for Africans, but obviously we're trying to expand our reach with who we're trying to reach.
So I know we've sort of discussed our layout of today's chat, so forgive me if I'm going a bit off track, but I think what you mentioned just a little while ago was really that emphasis on this app was not designed to substitute therapy or counseling or professional support in any way. It's designed to complement. Maybe you can tell me a little bit about like how you kept that thought in mind in developing this app, because I know as a clinician, this is really important to me, that there aren't really nice looking fun apps that come along and they're kind of claiming that they can be a substitute for actual mental health support.
Yeah, that was never our mission or our aim at all. We don't say we're a therapy app. We, like with our new AI feature that we just released, which I really encourage people to go check out, it's quite cool. We're very straightforward and adamant about the fact that we're a tool that can be used in addition to therapy or with a therapist or a mental health professional, wellness practitioner. We take a more promotion, prevention, skill-based and well-being perspective. And these skills and competencies that people can learn and develop, like anger management, yes, that can be used in a therapeutic process, but anyone can learn anger management. It's not therapy. We're not a therapist or therapist bot or anything in that shape or form. And because we take this kind of agnostic approach, we really feel that any mental health or wellness practitioner can use it in their approach, whether they're a psychiatrist who is helping to prescribe medication for ADHD. You can learn skills through the platform that help with conditions. We're not using diagnostic criteria or, again, labeling people. It's all about keeping that in mind. I hope I answered your question.
So I think my understanding is that you've really thought, you've been intentional in the development of it, that it's not intended to replace. It's not, like you said, a therapist bot, which I think, just in terms of relevant topics, I've read a couple of articles lately and it is terrifying, the stuff that is happening with people using AI as their therapist. And it's heartbreaking. It really is, because when you're in the profession, the damage that can be done. It can seem so harmless, but nevertheless, I digress. So I just, even today when I tried out the AI function, which was really cool, the massive disclaimer came up, just to reiterate that this is not a substitution for therapy or professional support from a registered practitioner. But like you say, anyone can use these skills. Anyone can benefit from these skills. Yes, a lot of these skills form a part of therapeutic processes because they are necessary skills, but anyone can benefit from them. I mean, I can think of teachers who are seeing a kid who is maybe going through a rough time, for them to say, hey, download this app. Obviously speak to your mom and dad about it first. Don't go charge it to their credit card. Download this app, give it a try. You can teach you some ways of coping with these intense feelings you're having. And if it persists, maybe to go see the school counselor or go and see a psychologist or something. So, I mean, even in those sorts of spaces where there isn't, like you say, pathology present necessarily, this can be a first-line intervention, but prevention rather. And it can also be used in combination with a registered professional, or it can be used after you've had a process with a registered professional. Counselors work specifically short-term. So, we'll see a client for a set number of sessions, and once the specific presenting problem has been addressed, then it's within our scope to actually terminate, to end the process. This is obviously different with psychologists, but I mean, I can see a lot of value saying to a client, okay, well, we've done the work that we intended to do. Now you can use this as a follow-up support, just to kind of extend that holding space for the difficulty that they're going through. So I like the idea of not a substitution, but a complement.
Exactly. It's designed as complementary to the therapeutic process. And when you're talking about schools and young people, that's also something we took into consideration. I speak very openly about the fact that I lost my brother to suicide, and so there was all this taking risks under consideration. How can we protect young people as much as possible, adults as well, And one of those considerations was being able to link people to toll-free help services if they can't access help, or they don't feel empowered, or because young people, they can't just hop in a car or, do things. They don't have that autonomy and agency all the time to be able to do that. So we built in a lot of those kind of things to try to protect people. I see we have a cool comment here in the chat from Tasha. I found that when actively working through difficult topics, downtime between sessions can lead to almost a dread of upcoming appointments when too much time elapses between sessions. Are there recommendations or suggestions to mitigate this? And would the Psyche app be an aid in instances like this? Yeah, 100%. Again, I try to be open and honest in these chats. I decided after the unfortunate passing of one of my very good friends that I wanted to start the therapeutic process, and I've done 8 sessions so far, and it's going quite well. But I too, I wondered if I was making the right amount of progress and if I was engaging properly, and I missed the session because we had a tech security thing that we had to deal with, and life happens. And I'm the founder of a tech company that makes a mental health app, and I'm doing therapy. So, I know I'm experiencing it as well. So yeah, we built the app to try give you those reminders, to give you those notifications, to stay engaged in your process, whether you're setting goals and working on goals, and whatever that is, or continuing with that skill that you're trying to implement. It can be something like mindfulness meditation, or a breathing activity, or practicing positive self-talk. That's something I constantly am trying to work on, to be less self-critical and more, practicing gratitude. So there's all these things. It would be disingenuous for any mental health practitioner or anyone to say that they've got it all figured out, and that they too aren't constantly trying to work on helping themselves. So to answer your question, yes, the app can help with those dead periods between sessions where people feel like they're struggling and they're not motivated and things aren't going right.
At the same time, and I feel like this question's actually got 2 parts. One is what can this person do? Sorry, WhatsApp is still harassing me. We tried to resolve my WhatsApp going ping, ping, ping in the background before this, and I used Control-Alt-Delete, and it's still beeping, so forgive me. The question, I feel, has 2 parts. So the one would be the fact that, yes, this app, I think, it's kind of like when I don't go to the gym for a long time, which I haven't for a while. I've been struggling with some chronic pain, and it's made it quite difficult. And the idea of getting back on the treadmill, the longer and longer I leave it, the bigger and bigger it feels. So this app could really assist in, it's like, okay, yes, between sessions, I'm not seeing my therapist. We did work on a really difficult topic, and it was heavy for me. But there's little things that I can do that feel a little bit like work without, so it's not a complete step away from that mindful part of the process. But also, I think really important, just as a clinician now, the app aside, speak to your mental health professional about it. What is this dread about? And maybe they can help you understand it or work through that with you, because that tells you a lot. What is it just the topic? Is it the fear that maybe you haven't done sufficient work between sessions, and now you're worried that your psychologist or your registered counselor is going to judge you? Or what is it about? So also just never stop engaging with the clinician you're working with.
Love that. Such mindful advice. Claire, how do you usually track a client's progress over time, especially the more subtle sort of non-linear improvements?
So, Daniel, this is a tricky one, because progress can look so different to different people. So I think the rule of thumb, especially as a counselor, a registered counselor, I mean, I can't speak to how a psychiatrist or an occupational therapist or a psychologist may work, but we've kind of been trained to not track process or progress rather, because it's not for us to decide. You know, if a client is saying that they're feeling better and they are sharing that they are able to do things and cope with things that they weren't previously able to cope with, and they feel like they've made progress, that is for them to decide, right? However, that being said, there are certain ways. I mean, we do a MSc, a mental state exam, which basically looks at how is the person sleeping, how are they eating, how are their energy levels, how's their sex drive, are there any changes in that, how's their concentration, how's their mood. You know, those are kind of ways to sort of measure, but at the end of the day, it comes down to the client, and they need to really be quite honest with themselves and say, I was here, I was feeling this way, and now I'm feeling this way. Is this better or is this worse? And if it's better, then we can observe that as progress. But what I really loved about the app was the little slidey function. So there's no numbers. So I remember numbers. I mean, I don't know if it's just the way my brain is wired or if it's just a fascination, but I love numbers. And my problem would be that if I scored myself with a specific number on the previous one, that would be in the back of my mind. But because it's just a color scale, I can be so honest with myself, and I literally just put it wherever I'm feeling, like whatever feels right in that moment. And I feel like that's going to give such an accurate, if you go and download the app, then obviously everyone will know what I'm talking about. But I really enjoyed that. That was the Psyche quiz, right? Let's make sure I got the name right. So in summary, at risk of rambling on, progress can only really be determined by the person. There's measures, there's assessments, there's a lot of tools that can be used to track, but realistically, if you're feeling good, if you're feeling better, there's been progress, I feel, at least.
Yeah, I love that. And obviously the clinical interview or screening tools can be very effective at determining, how somebody's doing. And what we wanted to do with the Psyche scale and assessment was give people a starting point. Just like trying to lose weight. If you don't know what you weigh now, how do you know what progress looks like and which direction?
I'm actually going to hold you there just for a second, at risk of perpetuating stigmas. I don't know how much I weigh. I haven't weighed myself in years, but there are other ways of measuring. So let's just be mindful of that. I know I'm giving you a hard time, but
no, good. No, it's good. You're not here to agree with me. But weighing yourself can be used in both ways. You could be training to add muscle and to get bigger and stronger. So I'm not using it in a way to shame anyone. But the point I was trying to make is that it's a barometer and a way to see, okay, which direction do I want to go in a way that's more nuanced. And I remember when we were building it, we did some interviews with some teens at a special needs school, and they actually ended up doing the assessments in pairs with each other and showing each other how they were doing. We thought, we thought people were going to be very, guarded about how they're doing, but they wanted to show people and they wanted to share how they were doing, which was an amazing surprise. And I remember asking them, what did you think of the score you got and how you're doing? And they're like, well, no one can be perfect. Anyone who's getting full marks or whatever is kind of lying to themselves, which I thought was very insightful for a 13-year-old. And he said what he really liked about it was that it showed him which areas he was doing well and could keep working on, and where he was struggling. And for him, it was the social domain. And he was like, okay, well, I need to work on seeing my friends more and spending more time with my family and whatever. And I didn't realize that things weren't as good there as I thought. And that's what we really like about it.
Tell me quickly then about the 8 domains, because I saw all the different colors, but part of it's not on my short-term memory right now. So why the 8 domains? What is the significance behind that? I mean, obviously it's evidence-based, that's a given, but what is what are they? Tell me about that, please.
Yeah, for sure. So they were informed by the determinants of well-being from sort of large international studies and combine a whole bunch of different psychometric scales into one thing. So like the Wellcome Trust study on well-being. So we broke it into, there were a lot of considerations that had to go into this, right? We didn't want something that was 100 questions that nobody would complete, and you didn't want it to be just like, how are you doing today, with a red angry face and a green happy face and a yellow, intermediate face,
We wanted Monday, Wednesday, Thursday, Friday, red face on Monday, and then a happy face on Friday.
Yeah, exactly. So there's a balance between asking too much and asking too little. So that was also one of the other considerations. We needed it to be visual. We needed it to make sense in a very straightforward way and take in the key building blocks of well-being. So we have physical wellness or well-being. So that's sleep, exercise, nutrition. There's social well-being. That's the connection domain, that sense of belonging and the quality of your relationships. There's sense of self-worth. So that's the mastery domain, that's self-confidence and self-efficacy. There's the flourish domain, that's life satisfaction and optimism. There's, I'm testing myself here as I go through this. There's the mood domain, which is about like emotion regulation. You muted? Are you checking the other ones to make sure I cover all of them?
I can test you as we go. Make sure you've got this right. Put you on the spot.
What have I done? Mastery, mood. There is the peace domain, which is about mindfulness and spirituality and living in the moment. I know I'm missing 2 at the moment. Let me go check. What have I skipped?
What are we doing right now? Have you spoken about connection? Have you spoken about resilience?
Yes, I've done connection. Okay, I skipped resilience. Resilience and focus are the 2 that I forgot. So resilience is like your sense of coping with stress and managing with difficult times and being able to bounce back when things get difficult. And then focus is creativity and problem solving and focus and attention. So these are all the kind of core building blocks that, as I said, anyone can work on, and you can learn skills to improve that. So there is one element of well-being that we haven't got there that somebody might say, oh, you're missing occupational well-being. And that we kind of intentionally kind of left out because we've designed something that's for young people as well, and young people don't necessarily have a job. And we also, we didn't want to focus too much on sort of like work or academic-based skills. So we wanted to keep it more psychology oriented. So
Daniel, though, yeah, even as you're speaking, I'm thinking, as you said, occupational, I was like, okay, maybe that's a really cool idea, but a lot of these skills can be applied in a professional space. So if you're able to learn time management, you can kind of, look, I'm not an occupational therapist. Perhaps the OTs watching this are going to be saying, Claire, what the heck are you talking about? But in my mind, at least, these things can be kind of translated into an occupational space, and all occupations are different in and of themselves. So I think the moment you start to add that element of wellness, you're looking at one segment of life, not, yeah. So I think that could be tricky. I think that would be a tough one to add. And then also you get to the point where you, sorry, my dog's biting my arm in the background. Just ignore that, please. I've been throwing her pieces of Vienna the whole time, trying to keep her entertained. It's been a multitasking nightmare. And now she's barking.
Switching lights, managing birds and WhatsApp, and you really are.
Yeah, literally busy multitasking. So maybe you can add that one, how to multitask the best. So I completely lost my train of thought.
Don't worry. We have a nice comment here that came through in the chat. I think for therapists, it can be difficult to get information from some patients using the Psyche skills to get patients to interact and as a starting point for communication between patient and physician, particularly for the younger generations who can struggle to communicate face-to-face, being an online generation. Yeah, exactly. Young people are looking for digital tools all the time, and it's starting to become a bit of an expectation in schools and universities and workplaces that they have access to tools and that they can use in their own time quickly, but also very importantly, connecting people with providers for when they need that kind of care. Again, I want to reiterate that we're not a therapy platform. We're not pretending to replace therapists in any shape or form. So yeah, exactly. Using the skills as a starting point.
I really appreciate that comment, because a lot of counseling is skills-based. I don't like the word empower because it's got a whole lot of problems with it, but equipping people maybe is a better way with skills, giving them the opportunity to use those skills, then allows them to unlock a lot of healing. And skills are maybe a more directive part of the process, where you can say, here, this is something that has worked for many people and may be helpful, go try it. Whereas with, generating insights or doing like deeper therapeutic work, that takes a lot of vulnerability on part of the client. And not everyone is ready the first session to be like, okay, let me open up my soul to you. Whereas skills are maybe a bit more practical. So it can be that sort of bridging at the beginning to say, here are some skills.
Yeah, exactly. We have some more cool comments that came through from Counseling Goose. Love how you make mental health feel approachable. This app sounds like it could even warm people up to therapy or counseling. 100%. A lot of people are very averse to therapy and, what's mental health? And I don't like it. And so it can be a huge starting point for getting people to access the care that they need. And then I see you have another follow-up question, Counseling Goose. Is the app user-friendly for neurodiverse individuals? Yeah, so we really have done as much as we can, being a small company, to make it as accessible and user-friendly for as many people as possible, to keep things simple and straightforward and easy to understand, easy to build on. And of course, neurodiverse is a huge, there's a lot of differentiation in there. So yes, exactly, it's diverse. So I'm not going to say that it suits everyone, but we've done what we can.
I mean, look, I can speak for myself as someone who is neurodiverse. I find it very user-friendly. Look, obviously, hence the word diversity. Not everyone is the same. Not everyone is going to have the same experience that I have. But in terms of the length of the activities, in terms of the way it's laid out, it's not too cluttered and overwhelming. The information is in bite-sized nuggets, which is really cool for me. And it's colorful and pretty, which I don't know if that's with neurodiversity or if that's just a Claire thing. I mean, that's entirely separate, but I've really enjoyed it. So if nothing else, I can, not intending to speak on behalf of anyone, but that's been my experience.
Oh, thanks for that. I appreciate it. Well, yeah, we did try to make it colorful, and we also, you brought up the lion earlier, and I didn't want to interject. And part of the reason we chose the lion logo is mental health is something that's heavily stigmatized. And I think I can speak for myself, that the further I went in mental health education and the more I started to know, the more I became blind to the fact of how little people know about it. In the same way that somebody who studies astrophysics and knows a lot about that doesn't realize how little people, the average person, knows about astrophysics, right? So, and people don't have the basic literacy around mental health and well-being. So we wanted to create an environment and a company stance or brand that was about, and then try not to use the word empower, but it encourages people to, because Kate doesn't like the word, that encourages people to grow and build and learn. And like a lion represents pride, and it's multifaceted, and all those colors represent all those different parts of you that we're all constantly trying to work on, and that we're all diverse. And And the last thing about the lion is, if you think of a male lion as a cub, like it grows into itself and it grows its mane and it starts to flourish, and it's a process of becoming. It's a constant journey. Exactly, and that's what we try to convey through what we do and the work we do, in terms of what we build and how we try to help people and our users as well. We try to listen to them as much as possible and take on their advice and considerations to serve them as best as possible.
I actually saw when I was using the app the other day, there is a button that you can press to give feedback as well, which I think is really cool, because that allows you guys to get information, not from focus groups, but from people who are actually using the app. And I think that's really quite special. The number of times I've gone onto App Store and rated a 1 because there's no way of giving feedback. I'm just like, that's so bad, fix it, but I can't tell you how. Oh goodness, my dog's now going on outside.
Yeah, and that's the process, right? It's a constant journey, and we're doing our best to constantly work to improve our offering to help people as much as possible. Claire, I have more questions for you as we start wrapping up. What happens when a client goes into crisis between sessions and can't reach you right away?
So my dog is in a bit of a crisis right now. Unfortunately, she's busy going a little bit wild. Let me quickly go to another room and just see if people can hear me. Sorry.
Sure, no problem. Right, while we wait for Claire to transport us out to a non-dog barking room, we just want to reiterate that sort of our approach is flexible in that we're trying to create a tool that therapists or mental health practitioners of any paradigm can use our tool, whether they work at CBT or DBT or and integrate in a way that feels right for them. And some of our clients have said, it's something that they bring into the first session and use it very hands-on with the client. And some people say, no, they wait till the third session, fourth session, and bring it in a way that feels right for them. And we're not prescriptive in terms of how people use it. And the other thing that's also really cool to keep in mind is what's the minimum dosage requirement for somebody to actually benefit from something? And for one person, it can be doing the assessment and, building that self-awareness and going, having that aha moment. And, that's enough. And others, they sit and they set a whole bunch of goals and they do it in the app and they benefit from that for a long time. Claire, you're back.
Yes. So I suppose it comes down to some subjectivity of experience, right? What you were needing from the app in that moment, it's dependent on you. So if you are needing to set goals and use all of the features, and that's how you gain benefit, that's great. And other people may just want to do the assessment, and that's what they're needing. So so in answer to the question, and I just want to make sure that I heard it right. Oh my goodness, she's in here as well. I just wanted to make sure that I heard it right. So between sessions, if there is a risk, obviously I'm just going to close the curtains. I'm not embarrassed at all. I promise I'm actually a professional person. My husband is just not home from work yet, so I can't even shout down the passage and be like, get this dog. So between sessions, if there is a crisis, we as HPCSA professionals and social work professionals with the SACSSP, I always get the letters confused. So registered health professionals, we have a code of ethics, and obviously just in terms of the Mental Health Care Act, we need to act ethically and responsibly. So if we are seeing a client, we need to have a consent form, and on the consent form, it specifies when we are accessible, how we are accessible, and what to do in the case where we are not accessible. And I think this app is quite special in that regard, because obviously we will still continue our own relevant informed consent process and giving clients or patients the relevant information for numbers they can call. But the Psyche app also has a function for that, function for emergency numbers, which I think is quite cool. So I'm about 85% sure I answered the question there.
You definitely did. Thank you, Claire. So obviously all practitioners have their different localized or national approaches and registration approaches, and part of that is also directing people to services that they can access, especially as part of the exit process if they're no longer seeing somebody. And that's also something we try to keep in mind with being able to refer people to those relevant services. Claire, we've reached the hour. I don't know if you have a last question that you'd like to ask or last thought, but I just want to say thank you very much for your time and for juggling all the responsibilities on your side and to be here tonight.
Honestly, it has been such a treat, and I just want to say, obviously, thank you for the app that you've developed. I think it is such a meaningful contribution, and the source of it, being the loss that you've experienced in your life. And now going from a loss, which is a lacking of something, to being able to give something, I think is really meaningful and really, really special. But also just to say thank you for being so understanding of my current demands. She is still very puppy and doesn't quite understand no or shush, and I ran out of sausages to throw for her. So perhaps it is a sign that we should end things off, but just a huge thank you. And I'm really, really proud to have the opportunity to chat to you about this and hear more about the app.
Thanks very much, Claire, and thank you for your time. And I just want to thank all of our attendees for joining, or participants. I hope you learned something, and please reach out to us to ask more questions about what we do, and please reach out to Claire to engage with her and her community and everything she's doing. It's been an absolute pleasure as always. Thank you very much.
I'll do a little Q&A on my Instagram profile. So if anyone's got additional questions, pop them through, not you, pop them through on Instagram, and I'll share them with Dr. Daniel Page and get you the answers.